I would like to discuss the topic of orbit of our eye. What is orbit, how it is developed, and what are its structures. So, development of orbit. We will start topic from the development of orbit. Orbit develops around the eyeball. Orbital walls derived from cranial neural cells which expand to form processes, frontonasal and maxillary processes. Lateral nasal processes plus maxillary processes is medial inferior and medial inferior and lateral orbital walls. Capsule 2 for brain forms orbital. Now, bone differentiate during the third month. During the development of eye, in third month, the bones of the orbit are differentiated, and later it go for the ossification. Ossification by endochondral and or membranous type. Frontal, zygomatic, maxillary, and palatine bones, intermembranous origin. Sphenoid, both endochondral and intramembranous origins. Although eyeball reaches the adult size by 3 years. Although eye reaches the adult size by 3 years of age, orbit undergoes considerable alteration in size and shapes and grows progressively till puberty. The growth of orbit grows progressively till puberty. Have you understood? Then what are the changes in orbit with age? What are changes? In fetus, the shape of the eye is oval. In newborn, the shape of the eye is round, and in 7 years of age, it is quadrilateral. 7 to adult, now the shape of the eye is quadrilateral. Now, what is the height of the orbit according to age? In fetus and newborn, it is 14 mm and 27 mm, vice versa. And in 7 years to adult, it is 28 mm and 35 mm accordingly. And this all is about the orbit dimensions according to age. Now we will discuss about the anatomy of orbit. What is the anatomy? This all was the development. Now we will discuss about the anatomy of orbit. Orbits are quadrangular, truncated, pyramidal in shape, bounded by four sides: superiorly, medially, inferiorly, and laterally. Superiorly, anterior cranial fossa; medially, nasal cavity and ethmoid ear sinuses. Medially, this one. Nasal cavity, this one is the nasal cavity. Now the ethmoid ear sinuses, this one. Then inferiorly is the maxillary sinus. This one inferiorly is the maxillary sinus, and laterally is the middle cranial fossa and temporal fossa. Now, what are the dimensions of orbit? Orbit's volume is 30 ml. Then the rim, this one. Rim is horizontally is 40 mm and vertically is 35 mm. Infraorbital width is 25 ml. Extraorbital width is 100 ml. And depth is medially is 25 mm and laterally is 50 mm. Now, what are the bones by which this orbit is completed? Made. Frontal, ethmoidal, maxillary, lacrimal, zygomatic, sphenoid, and palatine. By 7 bones by which the orbit is made, and 4 walls are included in making the orbit: medial, lateral, floor and roof, like a house. So this is the house of the eye. This is the protective house for the eye. Okay. Medial wall is anterior posteriorly. Okay. Frontal process of maxilla. By the frontal process of maxilla, lacrimal bone, orbital plates of ethmoid, body of sphenoid. By these things the medial wall is completed. Then it is the thinnest orbital wall of 0.2 to 0.4 mm thick, spaced 2.5 cm apart, parallel to each other, measures about 4.4 to 5 cm. Majority of it is formed by lamina papilis. Okay. Now landmark. What is landmark? What are the landmarks? That is the lacrimal fossa, forms the anterior part of the medial wall and formed by frontal processes of maxilla and lacrimal bone. Contains the lacrimal sac bounded by anterior and posterior lacrimal crests. Now, what is the applied anatomy? Since it is the thinnest, ethmoiditis is the commonest cause of orbital cellulitis, especially in the children. It is easily fractured during trauma and during orbitomy operations. Now floor. This one is the floor. This I have told you. This one is the maxilla. Okay. This one is maxilla, zygomatic bone laterally and palatine posteriorly on that side. Okay. Now it is triangular in shape. Shortest orbital wall, overlies maxillary sinuses and bordered laterally by inferior orbital fissure and medially by maxillo-ethmoidal sutures. What are the landmarks? Infraorbital groove, infraorbital canal, infraorbital foramen. 4 mm inferior to the inferior orbital margin transmits infraorbital nerve, infraorbital vessels. Applied anatomy. What is applied anatomy? Commonly involved the blowout fractures of the orbit, infraorbital vessels and nerve almost always involved, especially invaded by the tumors of the maxillary anatrum. Okay, now lateral wall. What are the lateral? Bones are included in lateral wall. It is a triangular make 45 degree with the medial plane formed by 2 bones, antizygomatic bone and post greater wing of sphenoid. Okay, separated orbit from median cranial fossa and temporal fossa. What are the landmarks? Special sphenoid area separates from the roof and floor by superior and inferior orbital fissure. Zygomatic merges with floor and joins the roof of the roof at front to form zygomatic sutures. More anterior wall is traversed by zygomatic groove and foramen. And anti part of the wall projection tubercle of Wittrand give attachment to the check ligament. In maxillary recession, if turbid of Wittrand damaged cause diplopia. Now, what is the applied anatomy? Protects only the posterior part of the globe. Only protects posterior part of the globe. Hence, Palpation of retrobulbar tumor is easier from lateral side than nasal, since lateral wall is almost devoid of foramen. Bleeding is less. The zygomatic sphenoid suture important landmark is creating the flap in lateral orbitotomy. Then roof. Underlying frontal sinus and anterior cranial fossa formed by frontal bone and lesser wing of sphenoid. Then triangular in shape, downwards, faces downwards and slightly to the upwards. Now, what are the landmarks? Is the supraorbital notch. Location is 15 mm lateral in supramedial angle. Transmits supraorbital nerve and vessels. Surface anatomy is at the junction of lateral 2/3 and medial 1/3, about 2 finger breadth from the median plane. Now, what are the applied anatomy? That is thin and periorbita peels away easily. Objects piercing upper eyelid penetrate roof and damage frontal lobe. No more blood vessels present can be easily nipped in transfrontal orbitotomy. At the junction of roof and median wall of the suture line lies in proximity to cribriform plate of ethmoid. Any trauma, rupture of dura mater and CSF escapes into orbit, nose or both. That's all for today. In next lecture, you will be studying about the more structures of orbits. What are the more structures in the orbit? Till that, you study this and try to learn the names of the bones and names of the fossas. These are important for anatomy of orbit, and try to learn them out. And if any query, then comment in comment box. I will be solving your query and in next lecture. And have a nice day. Stay at home. Stay safe. Till that, thank you and Shriya.